HealingYourself.Life provides information for awareness, educational, and support purposes only and does not diagnose or prescribe treatment for any medical condition. Viewers are encouraged to do their own due diligence and consult with their own medical caregivers before making personal treatment decisions. Welcome back to HealingYourself.Life. I'm your host, Dunnigan Kaiser, and we are with our off-grid MD, Jay Nielsen. He's in family practice in Northwest Ohio and also runs a off-grid survival compound in the country of Haiti. Dr. Nielsen, thank you once again for joining us on HealingYourself.Life.
Pleasure to be here.
We haven't dealt with this significant topic that we're going to today for all of our entire visits up till now, and that is that of cancer. But before we get into that, and I would say that's going to have to be one of a very impactful topic for most of our audience, if not every one of our listeners has been touched by this from a loved one or a dear friend or a coworker they've lost.
In an epidemic. We have an epidemic of cancer.
And but before we get into that, if you could say a few words to us about, in the theme of healing yourself, of taking real responsibility and accountability for managing our own wellness and even our relationship with our doctor, rather than just sort of becoming passive sheep in the system. And what your experience from the other side of the desk is, what's the most useful and impactful for people in that way.
Excellent. And I actually put these two together because I think this is where this becomes important. I think patients with cancer become extremely frightened, and they're the most sheepish. They're the most, I don't know what to do, I'm overwhelmed, I don't understand, and just do whatever you want to me. And much less than all other diagnoses right when they need to become an active advocate for themselves. And the other thing is I usually don't do any disclaimers, and I also would say very clearly that at no point in time in this am I recommending any cancer therapy to anybody, okay? The cancer therapy, unfortunately, in this country is limited to cancer oncologists. And anybody else who tries to treat it, state medical board rips them apart. So if you interpret anything, as I say, as other than referring you to the literature or trying to find your own path, you misunderstood me. The thing that you want to remember when you are seeing a doctor, and especially during a cancer visit, is that you're not being interviewed. You are doing an interview. You are paying, the money is being given to the other guy. You're the purchasing person, you're in control, okay? And to surrender that is a mistake. And so you need to show up at a doctor's visit, and I'm going to show you how to do this, and you need to prepare, you need to collect, you need to print, you need to save, you need to forward, you need to redirect files, you need to know what your objectives are, you need to have them written down, and you need to make sure that you insert them early in the visit. Every once in a while, I'll have a patient who will come in. The email they send me says, I'm menopausal and I'm having hot flashes and I'm tired. Okay? And some place down at the bottom, 35 paragraphs away, because they sent me too long of an email, it says, my foot hurt. Okay? And I sit down, I spend the whole hour with the patient, and we're both standing at the door with my hand on the doorknob going out of the room at the end of an hour. And they go, what about my foot fracture? I go, well, make an appointment. Yeah, the hour's up. Get back on the schedule. That would have been good to know, like 2 minutes into this visit, that you thought you were coming in here for a foot fracture. Know your priorities and insert them early in the visit. I tell all of my new patients, and when they contact me, they get asked this stuff, okay? And I'm going to hold this up and let you get a focus on it like we try and do. And I'm going to do the same thing if you want to do a screen capture on that. Okay? And I tell people that you want to send your doctor by email in advance of your visit so that it's digital and he can cut, copy, and paste and not type away and not, all those things. Although a lot of these guys are stuck on a radio button thing and you can't help them. And you also want to walk in, I don't have one on me, but with a USB thumb drive. And you really should be keeping a family thumb drive of every individual patient in your family, and that should be a living document. You should be sitting down every once in a while, checking your allergies, updating your meds, adding your surgeries, adding all of the files that you've collected that are JPEGs of your lab, your x-ray reports. All of that should be in each individual person's folder so that you can always walk into a doctor's visit. The greatest patient in the world for me is the person who, when I say, we need to go get this, and they say, I have that.
Mm-hmm.
I've just saved a visit. I've just saved, 3 weeks till you get back in, or my gosh, some of these specialists, 6 months before you get back in. I can't believe how many people I work really, really hard to get them into an emergency visit with somebody because they've had their first grand mal seizure, and then they show up with no records. And the guy walks in, and the only thing he says at the emergency visit is, I can't do anything, you didn't bring anything. And I'll see you in 6 months because I'm not doing 2 emergency visits. And so I can't tell you how important this is, but you want to send them your legal name. One of my bugaboos is women who are remarried and their email name is different from their married name. And they come in and they send me a name, and I look and I go, I don't even have that patient. No place in there is in their document is the name that they saw me as a patient. Okay? If you're running 2 names and you've got aliases, then your name should be in all of your emails. Your name, parentheses, aliases listed. Okay? Including nicknames, whatever it is. I marvel at the number of people who send emails with nothing but a nickname on them. And so you need your name, your date of birth, your address, your sex, your marital status, and all contact information, work, home, who has one anymore, cell phone, okay? Doesn't hurt to know your primary and secondary insurance. I really ought to add, I'm going to fix this right now, pharmacy fax. You want an emergency from me, then you want me to be able to, on Sunday afternoon, put something on a pharmacist's desk. I need a fax. I'm not sitting there doing hit 8, wait, hit 2. I just won't do it. I'll just put it in the mail to you and you can get it in 8 days. Then the next thing you need to do is briefly, bullet points, carriage returns, not a block of I typed continuously, it's right and left justified. My brain looks at that and goes, I can't read that. I send that stuff back to patients and go, I can't read this. With ADD, I can't read that. It needs to be short. Don't tell me long stories about your sister-in-law's dog's cancer, okay? I really don't care. I want to know signs and symptoms and diagnoses and tests and reactions. And if you look up and your summary of your health problem is over a half a page in a 12-point font, you need to go back and edit it down. Nobody's going to read it. Nobody has that time. Then you need to do a list of your medication, and those medication need to be the same way that I would put them in my chart. The name of the drug, 1 twice a day, number 60, or if you're on a 90-day plan, number 180, comma, and the number of refills you're allowed to have. And then a carriage return so that they're all stacked up, and I can pick them up in a block and drop them into my chart. And my entire, like a third of my data entry is involving medication. Mm-hmm. And people say, the little yellow pill, I think it's 10 milligrams. And I go, I'm dead. I got nothing. Nothing's happening at that visit. Okay. Then you need to separate that and do all of your over-the-counters, Motrin, Tylenol, topical creams, whatever you're doing. Weird treatments that don't fit into drugs, CPAP, TANS unit, all those things should be separate from your drugs. Another space, and then you should do all of your supplements. Those supplements shouldn't be by brand name. They should be by prostate. I take a product for my prostate. I know what's going to be in it, but if you tell me you're on prostate X, I'm not certain that's a prostate product. I need to know well, I'm taking a supplement for this. Some of them are easy. CoQ10, 100 milligrams. Okay, magnesium oxide, all of the information. I need to know on the back if it's magnesium, is it oxide, citrate, malate, right, etc. Right. Okay, and how much you're taking. Okay. Then you want to do a family history. You don't want to give the doctor the family history he'll type in his chart, which is a negative list this patient doesn't have a family history of. Okay? You want to give him the things that you look up and go, I really want him to ask me about my cancer history. All 3 of my siblings are dead from cancer. Okay? You can just put that down. You can put down what they were from if you know the target organ and the type of tissue, good. But you want to be driving in the fact that you have a positive family history. That's not the way most doctors record family histories. I don't have a history of this, that, this, and that, and this, and that. No, by the way, my mother had osteoporosis. You need smoking history. We're now starting to hear this. People are starting to talk about historical smoking. Okay? That's how doctors look at it. I smoked this many packs for this many years and quit in this year. Therefore, I have 42 pack years, number of years times the number of packs, okay, including decimal point, 1.3 packs per day, and quit in 1998, okay, because that's what's pertinent to smoking, and that includes chews, any form of nicotine. Same thing for alcohol usage. Then you got to get your drug allergies. Drug allergies to most people means hives. That is not what an allergy list should be for. An allergy list should be a list of drugs you never ever want to take again. And so if erythromycin made you throw up, then I put erythromycin, parentheses, emesis. Yeah, it may have been from gastritis, but I don't want to write you erythromycin again.
Yeah.
And so allergies should be a list of drugs you never want to take again. And in some situations, I'll tell people to use allergies to ban drugs. And so I have people who I've done PRP on them, and I tell them, I don't want you getting cortisone. Okay? And so you may want to put down, cortisone and let the guy talk to you about it, but make it so that he would have to prescribe something that in your records said was an allergy. Okay? And then that's going to, if he's any good, he's not going to do it. He's going to talk to you. Okay? List your surgeries, and your surgery should be as accurate as possible. So I had a lumbar L4-5 microdiscectomy by Dr. Blather in 2002. Comma, next one. Make them all align. Don't make them carriage return. That's only one line in a doctor's chart. It's not like drugs where you're putting them on separate lines. And then the same thing for serious history injury. And then you want to list all of your known diagnoses that are proven. If you, from your records, have the ICD-10 code, I-10.6 for hypertension, put it behind it. Save the doctor the work. If your doctor sent you a letter one time and gave you all your ICD-10 codes, they're important to pharmacists, they're important to doctors, and a lot of doctors spend a lot of time looking that stuff up. And so if you own it, but you want to do the diagnoses that you know you have. If you have a diagnosis that you don't think you have, don't put it under your diagnoses, put it under your problems. Okay? And then when you get done, your purpose is to have that first paragraph drive you to trying to solve the signs and symptoms and the misdiagnoses in your history and get your current doctor to take things off of I don't know what I have and turn them into I now know what I have. That's the purpose of healthcare. And you have to be sitting there with that in front of you so that as you're going through your visit, you're halfway through your visit and going, this isn't happening. I need to redirect. I need to go, excuse me, doctor, this visit isn't going where I intended. I know you have things to do, but so do I, and we're not talking about my foot. Mm-hmm. Okay? Does that make sense?
Yeah.
Okay?
Yeah, that so whole mindset, too, it's not, you were very practical in giving us some tips about organizing the information to help support an effective ownership of that time. but there's a mindset that goes with it too, and that's what you were saying in the
And
beginning.
said, you own this
I'm here
visit.
for
You're
my
paying
health.
for it. You're paying for it. Absolutely. And there are people who believe, no, not my insurance is. And I go, really? You didn't pay your premium? You know, and they say, no, my employer did. And I said, and you didn't take that out of your paycheck? I'm someplace, this ain't free. Someplace we're all paying for our health care. As a matter of fact, in my opinion, we're paying 10 times what we should pay for our health care, but that's a speech for another day.
Yep, and people who want to look at that one, we've got one called Robbing Us Blind. The Modern Medical System has us right where they want us with Dr. J. Nielsen.
That's
Look
right.
it up.
We covered that in detail. Yeah. We can do this for 10 cents on the dollar because I do it every day. Yeah, exactly. Now, to change subjects, we have some news since my last thing, and I try and stay current on things that happened. And Wednesday, I got a email from the Ohio State Medical Board that the Ohio State Medical Board, on the basis of the Attorney General of the United States declaring CBD oils with no THC illegal.
I did not know that.
Yeah, neither did I until Wednesday. And so the Ohio State Medical Board came out and said all marijuana products, including CBD oil, can only be dispensed in a licensed medical marijuana control program dispensary. Those marijuana products will have to comply with the rules and regulations of the Ohio law, which doesn't work. Okay? And there are 56 dispensaries, and if you didn't buy your CBD from one of those dispensaries, it's as illegal as marijuana. And did that make the front page of the paper? Wow, that's big, wasn't it? Okay. And I also like it when all of my idiot nut fringe ideas make the mainstream press. And I like this women's magazine, as I've told you before. First, there are a lot of women's magazines that I think are complete crap. But First magazine, my wife always, when she's reading me articles, I always go in the car. And I always go, is this First or something else? She says First. I go, okay, interesting. They really do a nice job. And this entire article, I Have More Energy Than Ever, was about EMF and turning off routers and not living under cell towers and how it shuts down your thyroid.
Holy smokes.
Yeah, and I went, really, mainstream magazine is actually covering electromagnetic frequencies, and of course you and I can't make it through a talk that I don't bring up EMF.
Right.
Okay, we're here today for cancer.